Good evening, everybody.
Good evening.
Thank you for joining us over FaceTime, those who couldn't make it today. My name is Olivia Killen, first off, and today I'm going to be talking about basic types of first aid and how to perform the basic types of first aid. So, pardon my voice, I'm a little bit sick, but nonetheless, we will continue. So, did everybody know that performing basic first aid could save someone's life? Or having the knowledge of it? And according to the British Heart Foundation, it's estimated 1,000 lives could be saved each year if members of the public attempted to resuscitate heart attack victims.
Wow.
So over 1,000 people could be saved per year. And a lot of educators and healthcare professionals need to know basic first aid, but I think it's important for even just regular everyday people to know it as well, because you never know when you will face a crisis and you might be the only helping hand there. And you don't want to stand by in the background. So today I'm going to explain how to perform 3 different types of first aid, being a heart attack, burns, and poisoning. So we're going to start with burns. There's 3 different types of burns: 1st degree, 2nd degree, and 3rd degree. I think there's also a 4th degree, but we're going to talk with the first 3 because those are the most important types of burns. So, 1st degree burns, if anybody doesn't know, is when just the top layer of the skin is affected. So with each degree, it kind of goes a layer deeper. So 2nd degree burns go a layer deeper. It affects the top layer and the bottom layer. And 3rd degree burns go all the way through. Every area of the skin is affected. And it might look, it's very graphic, but it might look charred. It might look white. That's how bad the burn gets. So 3rd degree burn basically destroys the tissue there. You probably won't feel that burn, that area, because the tissue is gone there. So on minor burns, you can basically treat it by running it under cold water and covering it with a non-stick bandage, as well as keeping it clean with a mild soap and water. So with 3rd degree burns, you need to get them into a safe area away from whatever caused the burn, and make sure nothing is burning on them, being clothing, and then call 911 and wrap the burned area with a clean sheet so it does not touch anything or get any other contaminants. So if you have a clean sheet around, or you probably won't, but just keeping them safe and away from the burned area is probably your best bet. So, and according to Jay Moyney, who's a medical doctor, he said the leading causes of accidental death are burns. They may occur because of fires, UV radiation, hot water, spills, strong acids or bases, and electrical shock. So it's the #1 cause of accidental death. So knowing how to treat a burn in a severe situation might save someone's life. So if the burn is severe, make sure to keep the victim safe from further injury. But if someone is suffering from an ailment you can't see, like a heart attack, what do you do? So the next one I'm going to talk about is how to help someone who's having a heart attack. So heart disease is the leading cause of death in the U.S. I'm sure everybody has heard that statistic, which includes heart attacks. So a symptom of a heart attack could include chest pain, dizziness, or shortness of breath. So there are 3 different types of action you can take depending on how severe it is, from the person being fully conscious and aware to this person being on the floor. So if the person is still awake, if they're allowed to be given aspirin and they say they're allowed to have it, give them aspirin. Do not give them any food or drink, and keep the person relaxed and reassured until the ambulance has arrived. And one of the most important things that I need to mention is that you should always call 911 before you perform any action on the person. So make sure 911 is called, or someone is calling 911 before you help them. So if a person goes unconscious, the first thing you need to do is make sure they're still breathing, and make sure to get them gently onto the ground, and keep their head supported and keep their airway clear until the paramedics arrive. So, and if the person does not have a pulse, you're going to have to do CPR. Does anybody here know how to perform CPR?
I know infant CPR. Is that similar to adult?
It's actually not. Thank you for answering. So, I have a printout for everybody to look at. It's a CPR poster. Everybody can pass it around and take a look. So I'm going to describe CPR later, but that you can use that as a reference as well. So here's how to perform CPR. You place one hand over the other in the center of the chest and push with good force and speed. You have to go really deep into there, and if you break a rib, you break a rib. You should go hard enough to possibly break a rib. That's how you know you're doing it. So, and then you also keep to the beat of Staying Alive by the Bee Gees. That's one of the most common things to do, which is kind of funny. And do not stop CPR by any means until the paramedics arrive, whether that be 30 minutes, an hour. You should never stop doing CPR. And if an AED is available, does anybody know how to use an AED?
No. I know where one is located in my building, but I don't know how to use it.
Okay, that's good. So basically, it's good for you because most AEDs come with digital instruction. Thank you, Adria. You can sit down. Thank you so much. So basically, using an AED comes with digital instructions, and they'll usually talk you through it as you set up the device on the person. So and then once the discharge is complete and the electrical shock is complete, then you can keep doing chest compressions. So never stop. Oh wait, no matter how dire the circumstances, 911 should always be called first. I have to say that again. It's very important. 911 should always be called first before you perform any type of first aid.
Is that true even if the person is saying not to?
Well, if you're performing CPR, chances are the person can't tell you not to call 911.
Good point.
But if they are having a heart attack and they're telling you don't call 911, you need to call 911 and make that judgment.
Right.
So now, lastly, we're going to be talking about poison. There are different ways someone can be poisoned. So if poison is ingested, what you need to do is keep yourself and the victim calm, reassure them that they're going to be all right, call poison control, and make sure to have their name, age, and medical conditions and what they could have ingested. Have that ready to tell the poison control so you know how dire the situation is. So identify the substance and keep it away from them, and whatever you do, do not make the person throw up, okay? If someone has ingested something, do not make them throw up. If the person is vomiting or fainting, you need to just call 911 immediately. Do not call poison control. If they're vomiting, you need to call 911. So if poison has made contact on the skin, you need to remove their clothes. I'm sure you've seen it all in science class. If you get acid on you, what to do. You strip all your clothes off and you wash the skin with warm water for at least 15 minutes until the affected area is better. And then afterwards, you call poison control. And then lastly, we're going to talk about if poison is inhaled, like carbon monoxide in a car. So get the person into fresh air. And if they're breathing, normally just call poison control. But if they're having trouble breathing, you call 911. Yeah. And if the person is unconscious, you call 911. Then CPR. Yep. And if someone else is nearby, make sure they're doing 911 and you're doing CPR, or vice versa. And then here's how you can learn more about first aid. There's many resources, there's online courses, there's lessons you can do, and there's lots of first aid training. You can find that on the American Red Cross website. I found that website to be very helpful. So do some of your own research to see if formal training is right for you. It's not right for everybody. So if you want to work in the medical field or in education, you need to know first aid. It's a requirement. So your employer will most likely pay for your training, but it's very important to have professional training if you're in a field like that. So, and also, according to the American Red Cross, you can learn first aid with flexible online classroom hours, and the classes are pretty affordable, I have to say. So, as you can see, having first aid knowledge of burns, heart attacks, and poisoning could be the difference between saving someone's life. So, with all the information I've provided, I hope you feel more confident in any of these situations, and I hope you all feel more confident about what to do in a critical situation. So I know you guys can do it. Thank you.
Yay. Now I feel like I can too.
Me too.
Thank you.